Human resource management in the healthcare industry isn't limited to hiring and firing decisions. It's an essential role with diverse responsibilities, including employee training and development, workforce safety, compliance with laws and regulations, creating a work environment that fosters growth and long-term relationships, and so on. So what are the real 3 major challenges for HR in the healthcare industry in 2023? Let's find out. Private practice owners, are you ready to rewrite the rules for your practice so you can have more time off, a great team, and more income while delivering better patient care? Then you are in the right place. Welcome to the Provider's Edge podcast. I'm your host, Sabrina Runbeck. I'm a provider, an international peak performance keynote speaker, and a best-selling author. My guests and I help providers like you control your practice, control your life, control your future. This is your defining moment to be a disruptor in healthcare. Before we get started, I want to wish everyone a happy holidays. And as we are jumping start into 2023, for those who wanted to make sure you are a finisher, not just a starter, listen to our episode number 3, where you can figure out the 3 major steps where you can do on a weekly basis to process your goal and have them aligned with your mission and get to the final step without holding yourself back. This episode is sponsored by Sabrina Runbeck LLC, yes moi. And as I selectively putting this episode for you, we wanted to celebrate the goodness that we do in healthcare and keep growing as healthcare entrepreneurs together. Enjoy! Healthcare HR professionals are the silent star ensuring you always have access to the right specialist. They oversee the hospital and physician group's staffing requirement for technicians, pharmacists, therapists, registered nurses, dietitians, and other medical and non-medical personnel who contribute toward the smooth running of a organization, assisting providers in performing their magic and managing employees and patients' experience. So taking care of all the healthcare hiring and other responsibilities successfully, especially in fields known for its high stress environment and turnover, is a major challenge in itself. But HR in the healthcare industry also face numerous external challenges that make their job much more demanding. Here's a look at the 3 major challenges in 2023 for HR in the healthcare industry, along with factors that compound the problem. Number 1, managing the high turnover rate. Isn't that something that we consistently talk about? The healthcare industry ranks among the top few industries with the highest turnover rates. This major problem is a manifestation of other underlying issues or symptoms that plague the healthcare field, resulting in medical employees quitting their jobs at such a high rate. So what are some of these? 1, an acute shortage of qualified and experienced healthcare professionals, especially specialties in niche roles, is the leading cause of high attrition. The supply versus demand gap makes it easy for healthcare practitioners to job hop, leading to inflated pay scales and poaching issues. Number 2, the abundance of jobs to choose from also makes it hard for them to stay at one place. If they feel uncomfortable with their higher up, their HR manager can result in an easy switch to another position. Maintaining an employee-friendly workspace has become imperative to improve employee retention. Number 3, due to its high-stress environment, career burnout is a growing concern in healthcare. Post-traumatic stress disorder is quite prevalent among medical professionals, while mental health challenges also compound the issue of retaining experienced staff members. Mental health issues amongst those working in the profession are rising rapidly. Number 4, safety-related challenges, like exposure to infectious disease, harmful radiation, toxic chemicals, and other issues that put a healthcare professional's physical safety at risk also add to the problem. Now, making a medical role sustainably for long-term growth, providing clinical staff with timely support to ease the pressure they're handling, ensuring the mental well-being and physical safety, and dealing with the last fallout of COVID-19 pandemic remains enormous challenge for the HR healthcare system. With the recent culture-focused place on work-life balance, it's more important than ever for organizations to ensure that their clinical and non-clinical staff are adequately cared for if they want to avoid massive resignations. The next big challenge is attracting clinical talents. Handling staff shortage due to lack of supply. Even as attrition continues to plague the medical industry, hiring qualified and experienced staff is becoming another challenge for HR in this sector. Although many qualified physicians, registered nurses, PAs, NPs, and diverse healthcare workers are necessary for a healthcare organization's smooth operation, their number pales compares to the population that needs to be served. In the absence of an adequate number of clinical staff required to serve the sizable chunk of the population, HR must rely on limited pool of talent to fill in all the proper position they need to hire for. This creates a supply versus demand gap where the supply is scarce and the demand is always on the rise. HR has to resort to investing in branding and marketing overturns geared toward attracting the right kind of talent at the beginning of the talent hunt, adding to overall hiring costs. Once they have a candidate inside, offering competitive pay package that exceed their competitors' best price become another issue. Finally, HR must also strive to create and maintain a good work environment to entice suitable candidates to join their organization, a difficult assignment even under the most favorable circumstances, let alone a fast-paced and high-stakes industry like healthcare. One way to tackle this challenge is to pioneer new ways to utilize a clinician's time using technology to do always the repetitive tasks that do not require human oversight, and relying on clinician adjustments professionals to pick up the slack. Consistently refining the process and procedure to ensure clinicians' talent, time, and roles are optimized for maximum efficiency is something healthcare HR professional must invest time and resource in. Last but not least, the third major challenge is balancing the budget, keeping costs down. The high attrition rate and the talent shortage gave rise to the third major challenge that HR in the healthcare industry has to contend with in 2023, keeping the rise costs of hiring, training, and retaining staff. Now, some reports have shown to replace a provider, it might cost anywhere between $1 million to $5 million. Versus a nurse, it's about 1.5 to 2 times of their salary. And the non-clinical staff is about at least 30% more than their salary. Because we have to consider the areas we just mentioned, training and hiring process besides just the retaining part, which can be tapped into how do you show depreciation in the right way. I actually do a whole assessment with the organization I help with. Even as the startups, you have very tight talent pool that are niched together. So when you lose someone, it's so critical and does not look well reflected on your organization. All right, there's a critical cost attached to the exercise of hiring a medical candidate. Time and resources spent on onboarding them, providing them the necessary tools. Even let's just say they have used Epic before, but we still have to go through how is the version of Epic different from this hospital versus the other organization. And skill development overall, people want to grow, want to feel like they can climb the career ladder instead of just being steady still and barely have any potential to have a bump in their salary each year, and spending on perks and bonuses to keep them satisfied within positions in the long run. Due to the first two major problems, attrition and scarcity of talent, the costs of hiring and retaining medical employees keep rising exponentially, with HR struggling to justify the over expenditure on a single candidate who tend to quit within months of being hired. I'm sure you guys have felt the same way, where some of the groups that you're with, the newer grads even are getting paid as much as some of the senior employees, and definitely make that senior employee feel unfair and could cause them to leave the organization. The cost of hiring eats into the budget allowed for other equally necessary functions, such as training and performance monitoring, counseling, claim handling, amenities management, and so on. The end result is a steep rise in the budget, pay scales, benefit packages, and other factors that impact the smooth operation and bottom line of the organization. And these additional benefits, especially in the smaller groups and business ventures, you already don't have a whole budget for employee benefit. Therefore, you have to be even more creative in finding out different ways that people wanted to feel appreciated and wanted to stay with you. The advantages of telemedicine, medical concierge, and home health services has also aggravated the problem of rising costs, as clinicians are opt for less stressful positions to strike a better work-life balance as they work remotely. Competing with international pay packages is one of the latest challenges that's come up due to this situation. Strategic budgeting, planning, and allocating programs, standardized hiring guidelines, and investing in research and resource to combat rising costs of hiring are the need in this time right now. To conclude, HR leaders need to continuously educate themselves and evolve with the time to stay ahead of the various challenges they face in the coming years of this rapidly evolving healthcare sector. The aforementioned issue and steps we have identified are a sure way of doing this. Whether it's improving employee engagement, dealing with telemedicine trends, or creating competitive pricing package, HR leaders need to stay on their toes to overcome the hiring challenge facing the healthcare industry. Thank you for listening to today's episode. If you're like me who just want to get to the bottom and find out what's going on in your practice, then I invite you to book a complimentary peak performance diagnostic call with me. You can check my availability at sabrinarunbeck.com/blueprint to find a time that works for you. This is especially beneficial for you if you have an established clinic but now feeling drained, want to do more for your patients but are limited in your capacity, or are unable to live up to your full potential. Don't you agree that if you don't allow a pair of unbiased eyes to take a look, you'll never know what you don't know? This is your chance to gain back time and be a peak performing healthcare leader again.
Gosh, I went through my list of things with you that last day, and I kept them on my notepad. They're all, and I told you as a sheet, I move a lot of my really important stuff too. And then you made that sheet to all the things we did. I think there were a lot of things in there. I look at the chart of the desire zone because I was taking on too many things. I was doing too many things outside of my desire zone. And that allowed me to hone things back into the direction where they should be. What was some other things? Our first call that we ever had, there was a quote that you gave me from the Dalai Lama. And these are simple things. I did, but it was about gratitude. And it hit me at that time because I'd forgotten to be grateful about what has been built. Everybody around me that sees what we're doing or sees what I'm doing here, my peers and colleagues, they're very grateful for what I've been doing. They're like, oh, this is great. Would love to be in the position I'm in, and I forget that. But I forgot it. So that was another one. And then what was some other stuff? I'd have to go through my list. I mean, there's, the 2-minute reset stuff that we do, just a little bit. And we even, remember, been a big meditator for a long time, and everyone goes through cycles of this, but I was so dedicated. It was 45 minutes to an hour every single day, probably at night as well. And then in a busy lifestyle, you go, oh, can't do that. Then you started thinking, well, if I can't do 30 minutes or an hour meditation, then why even do it? But you're teaching people to do 2-minute meditations, which 3 2-minute meditations throughout the entire day, 6 minutes total, in my opinion, is better than doing 45 minutes an hour every other day. It just made more sense. And it was so much easier just to kind of center myself back in and go back at it. So, and one thing now, I'm going to have to do a plug here, is this. Yeah, and I was going to do this, didn't you? So this clock right here has been, I don't know if yours is next to you or not, but you held this up for me one day. And we're talking about time blocking, time blocking and everything else. I said, well, where is that? So I bought it on Amazon, and it has the clock and the 5 and 10, 15 minutes and so forth. It is awesome. And so when I started using this thing, I started realizing oh my gosh, when I'm actually tracking my time, I've got a lot of it. When I'm not tracking my time, even if you take a 5-minute break to surf the internet and it's 15, 20 minutes later, the time goes fast. So it's been I can get so much stuff done in a 15-minute period. It's crazy.
Now open up a browser and type in sabrinarunbeck.com/blueprint. Let's create a blueprint for you to gain back a day per week and creating more impact, income, and freedom in your day. We'll talk soon.